If you've applied for Medicare because you are turning 65 or you're retiring and you're waiting for coverage to start, you may feel overwhelmed by the unknown. In this video, I'll walk you through what to expect after you apply for Medicare and make sure you stay to the end of the video for important tips that are not commonly shared once your Medicare starts. Hi, my name is Joanne Quinn. I'm an independent insurance agent and have helped thousands of beneficiaries since 2013. If you're ready to get started, hit the like button and subscribe for future videos. Once you apply for Medicare, Social Security usually mails a letter informing you of your application status. However, if it's been more than a month since you applied for Medicare and you haven't heard from Social Security or received your Medicare card, you can call Social Security or check your online Social Security account for updates about your Medicare application. Now, why is it important to stay on top of your Medicare enrollment? Well, if you're losing your current health insurance plan, you don't want a gap in coverage. And if you want to sign up for any type of Medicare supplement insurance, most insurance companies ask for your Medicare number on the application. So this is why it's important to get your Medicare card in a timely manner. And since you have a limited amount of time to sign up for supplemental plans, you'll want to be aware of the deadlines. In many states, you can apply for Medigap, also known as Medicare Supplement Insurance, up to 6 months before your Medicare starts, and your Medicare supplement coverage will begin on your Part B start date. However, once your Medigap open enrollment period expires, which is 6 months from your Part B start date, you may have to medically qualify for a Medicare supplement plan moving forward. So it's important to pay attention to the Part B start date on your Medicare card. Now, Part D drug plans and Medicare Advantage plans have a different enrollment window. You can sign up during your initial enrollment period, which is the 3 months before your 65th birthday month and the 3 months after your 65th birthday month. If you miss your enrollment window, you must wait until the annual enrollment period, also known as the Medicare Enrollment period, to apply for coverage, and then the new plan starts January 1st. Now, if you're over 65 and you're coming off employer health insurance and you've applied for Part B, then your Part D and Medicare Advantage enrollment period is different. You have 60 days from the time your employer insurance ends to apply for a Part D drug plan or Medicare Advantage plan. Now, it's important to note that if you are losing employer health insurance, your Part D drug plan company or Medicare Advantage plan may ask you to confirm your prior coverage. Please do not ignore their request, or else you may have to pay a late enrollment penalty for what they deem is the amount of time you went without creditable prescription drug coverage when you are Medicare eligible. Now let's talk about how much Medicare costs. Unfortunately, Medicare is not free. Although most people do not pay anything for Part A, Part B has a monthly premium, and the amount can be quite shocking to some people. That's because Social Security determines your Part B premium amount based on your adjusted gross income from your tax return 2 years ago. And they'll reevaluate your Part B premium each year and send you a letter in the fall with your new premium amount for the upcoming year. Now, how do you pay your Part B premium? If you're not taking Social Security benefits, then you'll receive a quarterly bill from Medicare to pay the Part B premium. However, if you are receiving Social Security benefits, your Part B premium will be automatically deducted from your Social Security benefits before it's deposited into your bank account. Now, this video is full of tips, but I saved 3 bonus tips for the end because they are not commonly known to new Medicare beneficiaries. The first one is cancel your old insurance. If you have health insurance that you don't intend on keeping when you start Medicare, you need to cancel that coverage so you don't accidentally pay for 2 insurance policies. Medicare Enrollment does not automatically cancel your current health insurance policy. Number 2, mark your calendar. The annual enrollment period, also known as the Medicare open enrollment period, is always between October 15th and December 7th every year. This period of time allows you to change or purchase a new Part D drug plan or Medicare Advantage plan. Keep in mind, this open enrollment period does not give you an opportunity to change your Medigap, also known as Medicare Supplement plan. Medicare Supplement plans can be changed any time of the year. However, many states require medical underwriting approval to do so, unless of course your state has a special enrollment opportunity available. Now, the third and maybe the most important tip is to review the annual notice of change. One of the most crucial things to do every year is look for your annual notice of change from your Part D drug plan company or your Medicare Advantage plan. The insurance company should send you the annual notice of change in the fall. The annual notice of change provides a summary of any updates to the plan's costs and coverage that will take effect on January 1st of the following year. Unfortunately, I've had people call me in January that did not pay attention to their annual notice of change and missed important updates to their drug plan benefits and premiums. And then they were stuck with a higher cost plan or one that doesn't cover all of their medications. And once the December 7th enrollment deadline ends, you can't make any changes to your drug plan or Advantage plan. So while it's a good idea to always open mail from your insurance companies, it's especially important to look for the annual notice of change every fall. Well, that's a lot to take in, which is probably why so many people feel overwhelmed about Medicare. But as you gather and process more information, you will start to feel more comfortable. And if you want to keep learning more, please sign up for my free Medicare e-course, where I have additional videos about enrollment, the different parts of Medicare, deadlines, and more. Thanks for being here today. I'll see you next time. Why is this? If you hold on, let's go. Agent and to health insurance cut in a timely manner. The deadlines. Important too. And here we are. We're stuck again.